We're here again with Michigan Bariatric Surgery and Dr. Jason Riscala, and he has some exciting news to share with us.
Yeah, hi there. My name is Dr. Riscala. I'm a bariatric surgeon here at Ascension Weight Loss, and I wanted to share that we have started doing the Orbera balloon. It's a procedure that's been around for many years. I recently took an interest in it because it has opened up my practice to allow a procedure, or to offer a procedure to patients that I normally couldn't operate on because their weight doesn't qualify. But basically, the Orbera balloon is an intragastric balloon, or a balloon that sits in your stomach. And it's not a new concept. It's been around for about 20 years or so. But it's something that allows us to place a foreign object in the patient's stomach and help with weight loss. And the reason that it's beneficial is not only do you lose weight, but it's patients who have BMIs less than 35 can qualify. So it allows us to offer more to patients who may not be able to have a procedure because their weight doesn't qualify them.
So, Doctor, the Orbera balloon is very fascinating once you do the research. But you offer the whole gambit of services here. What has the COVID-19 pandemic done to what you treat?
So that's a good question. So, for one thing, it's been shown, and this has been known for a long time, but with any disease process, obesity lowers the immune system. And so when you have a pandemic going around, an upper respiratory virus like COVID that's affecting people's immune systems, we know that obesity is going to put you at a higher risk for complications, morbidity, mortality. We're seeing some more interest in weight loss in general. The Orbera is nice because it gives us another option for patients who don't want to undergo surgery, but they still want something done from a procedural standpoint. Also, to qualify for Orbera, your BMI can be between 30 and 40, whereas with bariatric surgery, it's 35 and up. So it just gives us another tool in our arsenal to combat obesity. We are seeing a lot of interest in the surgical side as well, and I think that the pandemic is partly to blame for that as well. I know that a lot of people have gained a lot of weight in quarantine, and we've been seeing that a lot. So, the pandemic has played a role in my practice.
Doctor, one of the other things that I really appreciate about you is that you make yourself available for your patients, and now you're going to open yourself up to even a wider audience. Tell us a little bit about why that's important to you.
So, with every patient that I see, either in the clinic or in the operating room or in the hospital, I provide them with my personal number, which is a direct line to me, because I feel that it's very important that patients are able to get a hold of their surgeon in a fast manner, just in case there's ever any questions, if there's any sort of complications or any sort of concerns or anything at all. I think it's important that there's a direct line of communication between the surgeon and the patient. And so that number is open 24 hours. It does not bother me to get a phone call at 2 a.m. I would prefer a phone call than a patient showing up in the emergency department when they didn't need to. So I think it's best that, the patient feels comfortable contacting their surgeon and they have a direct line to do that. Some surgeons, some other physicians, they'll have a call line or something you can call, and then it dials out to an agency, and the agency gets a hold of the doctor. That works, but it's slower, it's a little more informal, it doesn't feel as close, so I don't do that. I provide a direct line to me.
The other thing that I really like is the fact that you don't just come to see you to have a surgery or procedure. what your team offers is a comprehensive weight loss strategy to assist the patient in lifestyle changes and diet changes. Even the Orbera balloon procedure comes with this whole 6 to 12 month program. Can you touch on some of that for us?
Yeah, absolutely. So our clinic is a weight loss clinic. Our goal is for weight loss. The surgical side of it is one side of it. We do medical weight loss. It's actually a big part of our practice. We have a medical bariatrician who's an MD who only does medical weight loss. We have several dietitians. And then we've now introduced the Orbera, which gives us, it's sort of like an intermediary between surgical and non-surgical. It's for patients who aren't losing the weight on the medical side, but they don't want surgery, or they don't qualify for surgery because their BMI isn't high enough. So it's that extra tool that we have that we can use for patients that are struggling. The Orbera balloon is not an option for everybody. There are some reasons why you can't have it. There's also a financial aspect to it. Whereas bariatric surgery is covered by insurance, the Orbera balloon is not covered by insurance. And we have all that information available on the website. But it's something to keep in mind. This procedure isn't covered. Will it be covered in the future? It's possible, but at this point, it's not covered. It's a cash pay or a cash option only. So that's just something to keep in mind. Bariatric surgery, on the other hand, the gastric sleeve, the gastric bypass, these are operations that are covered by insurance. Most insurances, in fact, we very rarely have insurances that don't cover those procedures. And whether or not you're a better candidate for the Orbera, you're a better candidate for surgery, or you're just a better candidate for medical weight loss, is something we can help you with. You come into the clinic, we can take a comprehensive medical history and figure out what's best for you. But the nice thing about our clinic is that it's all inclusive. It's all here in this clinic. We have the medical, the surgical, and then now this Orbera balloon. So it's a nice, convenient location that encompasses everything for the patient.
You also have support seminars and things like that, at least on a monthly basis, so people can talk with some people that are suffering from the similar disease and going through the same process. So that's always a good thing as well.
Absolutely. So I personally hold a monthly or bi-monthly seminar where I used to do them in person, but because of the pandemic, I've been doing them on Zoom, which I do not prefer. I like seeing people, but as of now, we're trying to keep the social distancing rules in place, and so we've been doing it on Zoom. So every month, or usually about twice a month, I will have an information seminar on bariatric surgery, and we have monthly support groups where patients meet with our dietitians. And they talk about their journey, whether they're pre-op, they're post-op, or they're still deciding whether or not they want surgery. It's an excellent place, so patients can come together and they can share their experiences with everybody. These are free support groups. It doesn't cost you anything to show up. And if you're just considering bariatric surgery, it's a great place to start because you can hear from real people about whether or not this is something you can do or something you want to do. So you don't have to hear it from the doctor, you can hear it from real people.
So it's a 360 approach. Not only do you have the surgeon that's going to be available, making himself available to talk with you, but you have dietitians to help you with the diet and lifestyle changes. And I think I remember reading somewhere where one of the dietitians or one of the people from your team, they have had the procedure.
So it's funny you say that. Actually, we've had a couple of people. So our office manager, Ann, has had the procedure, and one of the physicians has also had the procedure. So we have an extensive group of people who are intimately involved with the program on a personal side and from their own professional side. We understand that it's a sensitive topic. We see a lot of patients who they don't want people to know they've had surgery. They don't want family members to know. We keep everything confidential, but we have a community that we built so that you can still talk about these things, with other people and still keep it confidential. People within our office or people in the support groups. So you have that option. And I always tell patients that, if they're struggling with their weight, they should come see us, whether or not they want surgery. I mean, I always offer the surgical side of it, but if they get to the end of our conversation and it doesn't look like it's something they want, it's no big deal. There's no obligation. You can also go through the process, which is usually a 6 or 12-month process. And by the end of that, if you decide, I don't want surgery, there's no obligation there. That process is where you see the dietitians monthly, and that process is free of charge. You do not get charged for those dietitian appointments. So it's really no risk. It's just a matter of having somebody help you with your diet. By the end of the process, if you decide you want surgery, we're there. And if you don't, then you can walk away.
Well, we want to thank you again for taking some time out of your busy schedule to talk to us about the Orbera balloon and the other procedures that you have here. Thank you so much, Doctor.
Well, thank you, Marty. We're really excited about the Orbera. If you have any questions, please visit the website or give us a call, 248-831-0806. Thanks, Marty.
Thank you so much.